I am Dr. Sterling from the Departments of Pediatrics and Orthopedics. This video will focus on the musculoskeletal examination of the knee. We will review several aspects of knee examination, including inspection, palpation of the superficial anatomy, assessment of range of motion and muscle strength, tests to assess injuries to the patella, the ligaments of the knee, and the menisci. When viewing this film, pay particular attention to hand placement when performing these tests. Of course, prior to beginning any examination, it is important that you wash your hands prior to approaching the patient. First, I'd like to take a look at both knees, and I'd like to see if there are any noticeable deformities or any evidence of joint effusion. And it doesn't appear there are any at this point. The next aspect of the examination I'd like to review is palpation of the superficial anatomy. I'd like to begin by using the inferior aspect of the patella as a starting point and palpate at the inferior aspect of the patella, moving along the patella tendon, moving down to the insertion of the patella tendon. Next, I move back to the center of the patella tendon, and I move medially and palpate along the medial aspect of the tibial plateau out to where the meniscus would be located, looking for any aspects of tenderness. I move back to the medial aspect of the patella tendon and up to the femoral condyle, again palpating for any tenderness. Again, localizing at the patella tendon and moving outwards along the lateral aspect of the tibial plateau. You can feel where the lateral meniscus is located and palpate for tenderness. And moving a little bit further out, you can feel almost a piano chord-like structure, and that is known as the lateral collateral ligament. Now, to palpate this even further, Tim, would you mind crossing your legs? If you begin at the medial aspect of the patella tendon and move your hand out along the joint line, you can feel a hard cord-like structure, and that is the lateral collateral ligament. Next, we're going to assess range of motion and muscle strength, and we're going to combine the two assessments into one in order to make it the most comfortable for the patient. Tim, I'd like you to extend your knee as far as you possibly can. Okay. Can you hold it up there for a second? Mm-hmm. You can get a general idea of muscle symmetry of the knee extensors by viewing the extensor musculature in the thigh. Tim, I would like you to hold your knee up, okay, and I'm going to take an assessment of your muscle strength. I'm going to push down with one hand approximately 3 times. 1, 2, 3. Okay, you can bend your knee now. In order to assess knee flexion, have the patient laying in a supine position. Tim, can I ask you to bend your knee as far as it will go? Very good. Okay. The next aspect of the knee examination is to assess for a joint effusion in the knee. In order to do this, you take your non-dominant hand, make a V, place it on the medial aspect of the distal femur, and move it down, applying downward pressure, attempting to capture and move any fluid that is present into the knee itself. The next aspect is to gently press downward on the medial aspect of the patella. If a joint effusion is noted, there will be a sensation of the kneecap floating at